Okay, what is this? Is it a kid's STEM toy? Some kind of futuristic kitchen gadget? Nope. This is actually part of a surgical system I use to place breast implants in a more controlled, minimally invasive way. This is the Preserve Toolkit by Motiva. It's both a toolkit as well as a technique. You might even say it's a little bit of a philosophy. It's designed to place breast implant with less tissue manipulation, potentially a smaller incision, and less anesthesia, possibly even just numbing medicine alone. I'm going to use my trusty model to show you exactly what makes this technique different from a traditional breast augmentation and who might actually be a good candidate for it. So watch till the end to understand more. Traditionally, when placing a breast implant, we'd make a small skin incision here, like on the patient's left, elevate a pocket either above or below the muscle using sharp dissection, and then place an implant. Now, most people are using this funnel system to squeeze an implant into the pocket, just like we show on this side. There's an implant in there. Where is it? Here we have an implant. This is above the muscle. This pec is this black thing. This is breast tissue. We can also have the implant placed in the dual plane or behind the muscle, implant below. Why would you do it under the muscle? For some patient anatomy factors, but also because of the devices we had for many years. So as you can see in this clear implant, you can see some folds and bends in the shell. That's called rippling. And for patients with very thin skin or thin breast tissue, you might see the outline of that under your skin. So we prefer to put those under the muscle in those patients. That changed when we got the sixth generation Motiva cohesive gel implants. These are more cohesive and more filled, 100% gel filled. So as you can see side by side, you see less rippling. This means that more patients, especially thin patients, thin skin and thin breast tissue, they are now candidates for above the muscle breast augmentation. That means less pain, less tightness, and an easier recovery. Motiva took that concept even further and developed this toolkit that I showed you at the beginning, the Preserve. This allows the implant to be introduced in a more guided, controlled way. So the way this works is same thing, we make an incision, but then put lots of numbing medicine in the pocket, no sharp dissection. We'd actually just use this tunneler to create a pocket in the upper pole where we want fullness. Once that tunnel is made, we remove this, place this balloon inflator, same tunnel where we want the volume, and then we would use air in that balloon to stretch out a pocket. We'd remove this and then use that funnel to squeeze in a smaller implant in the upper pole, targeted where we want it. Because there is less sharp dissection, some patients can undergo this procedure under just numbing medicine. It also means because we're targeting enhancement and balancing the breast, we can use a smaller implant, which means less weight on your tissue over time and potentially more durable results. The ideal patient for Preserve breast augmentation wants a small to moderate increase in breast size. The upper limit of implant size we can use using this technique is 315 cc's. So patients who want larger would not want this technique. Patients who have very loose breast skin after pregnancy, nursing, or weight loss would also not be ideal candidates for this technique, as you might need a larger implant to fill out the pocket and stretched out skin, or even consider dual plane for more balance and filling of the pocket. Preserve is not intended for an under the muscle technique. Lastly, I personally prefer this technique to be paired with a breast lift. Many patients come to us with deflation and sagging, nipples low, and they just said, I just want to lift, but maybe some upper pole fullness. Preserve is ideal to dock a small implant in the upper pole, and then I can use my techniques to rearrange your native breast tissue on top and around that small implant, lift up your nipple, and create a beautiful lifted breast mount. I hope this is helpful. Please drop any questions into the comments below.